Hi, this is Dr. Tom Rogers at Performance Medicine. Today in Bristol with Jill Henritze.
Hello.
A wonderful PA that has so much experience, especially in orthopedics. She worked orthopedics for 20 years before she joined our practice and went the integrated medicine route. And she's amazing at it, all of it. You know, when it comes to orthopedic problems, I defer to her. And one particular thing that we're going to do today, you'll watch it, that she did on me 2 years ago is called PRP, platelet-rich plasma injections, which we use for a lot of different reasons, you know, from pea shots to joint shots to shots in the scalp to grow hair. It's kind of a regenerative process that's related to stem cells, except it's coming from your own blood. I just had my own blood drawn and spun down and get what I call liquid gold out of it. And it's an amazing procedure, amazingly effective. I can tell you, I did this procedure 2 years ago on my knee, and because I was really having a lot of pain. And I probably had a little small meniscal tear from, you know, pickleball, tennis, basketball, all the stuff that I love to do. And I can honestly tell you that for 2 years, I was pain-free, and I'm starting to get a little twinge in there now, a little sharp pain when I pivot with pickleball or first get on my bike or go downstairs. I'm getting the sharp pain in there. So Ernie said it's probably a little tiny tear in the meniscus, and you confirmed that when you just examined me. But so I'm going to do another round of PRP in this knee and go from there. It certainly beats some, you know, repeated cortisone injections that really may help you temporarily, but this is really kind of a fix. I mean, if you have bone on bone, it's not going to work. But you do a lot of this stuff up here. Kind of tell us kind of how it works and what do you think the theory behind it is?
So I think, you know, we're eliciting really your own body's healing response. So we're taking that platelet-rich plasma, which I wish we had separated it before so that people could see the liquid gold for sure, because it does definitely look like liquid gold. Sometimes when you separate the two, you get a little tinge of blood in there. You know, you've gotten it all, so it'll turn it a little bit red. So that's the way it will look when we're injecting it. But so you're taking those platelets and the healing factors, the growth factors that are concentrated in that plasma and injecting it into the area of injury, whether it be a meniscal injury or arthritis or chronic tendonitis or a traumatic injury, whatever it may be. And then you're creating, really, you are creating inflammation. It's like you're sending a signal to your body to say, hey, there's something going on here. We're creating a healing response, and then it's going to send more things there to help you heal that area. It's going to take a little bit of time, but that's kind of the gist of how it can work.
I noticed that it took a couple months really before I really noticed a huge difference. But then all of a sudden it really was pain-free.
Yeah.
Do you like to inject tendons as well as joints?
Yes, you can do chronic tendonitis, you can do acute tendonitis, I mean a lot of tennis elbow or lateral epicondylitis, plantar fasciitis. You can use it for obviously arthritic injury, meniscal injury. I mean, we use it even, you know, intraoperatively if you're getting a rotator cuff repair or some type of, especially a tendinous type repair. Sometimes they'll draw PRP while you're in the OR actually at larger quantities and then inject it or place it right on top of that repair to stimulate more healing. Yeah.
Why not?
Yeah. So, and the good thing is, like you said, it's safer for the joint than the steroids. It's not going to damage the cartilage or have the side effects that some steroids do, especially if you're diabetic, raising your blood sugar, you know, and those types of things. And it's your own blood product. So, you know.
So it's very safe.
Right.
You know, stem cells may be the ultimate thing, but really, unless you're getting it from your bone marrow or fat, you know, it's not really, FDA does not like it. So, you know, maybe someday we'll have that ability to inject Wharton's jelly, placental type stuff, but it's so controversial that the PRP works. There's no doubt about it.
Yeah, I would say most people that I inject work, even with end-stage arthritis. I mean, definitely, like you said, we're not going to reverse that. We're not going to, you know, make end-stage arthritis mild arthritis, but sometimes it can treat the symptoms for a while. And if you're trying to avoid knee replacement, or maybe you can't have it for some reason, or you want to obviously trial the conservative treatments first, then the PRP can be helpful in treating that pain. So, I mean, I've had one guy that really needs a knee replacement, honestly, if you look at his x-rays, right? But he's gotten PRP like once a year for the past several years, and it definitely works for him for 6 to 9 months. And then he'll get it again, and it's kind of keeping the surgery at bay. So,
do you ever do like a combination of PRP one time, and then maybe if he flares a little bit, poke a little cortisone in there? 2 or
Yeah.
3 times a year maybe?
You
if have
could.
to?
You just want to make sure you're separating that cortisone from the PRP because
sure.
it could affect its efficacy. I
Right.
mean, it's not contraindicated, but if it's decreasing inflammation, which is kind of what we want, we don't want to put the PRP right on top of a cortisone injection. So I usually recommend people wait 6 to 12 weeks, really, but if they get a steroid shot.
Okay, 6 to 12.
Yeah, 6 to
Okay.
12. If we can go 12 and you're comfortable, then I think that's better. If, at the earliest, I would say 6 weeks after a steroid shot.
So I really shouldn't take any anti-inflammatories for a few days after this. Is that right?
Right. I'd say for at least 3 days.
3 days.
I would wait.
Can I play pickleball tonight? I've got a match.
Oh. I don't know that I'd do
I
that.
knew she was going to say
yeah,
no.
no.
How long should I wait before I get on the pickleball?
Pickleball, since you're going to be, kind of jumping around and cutting, would wait 5 to 7 days at least. I mean, up to 3 weeks if let's say it hurt worse after we did the PRP, which is possible. I don't expect that to happen, but it could. So if you had increasing pain, or let's say for a joint, like what we're treating for you, maybe arthritic change, a little bit of a meniscal injury potentially, I would say take it easy for 3 to 5 days, something like pickleball, maybe a week,
How about
maybe.
maybe a little bit of biking.
Biking, I think you could do in a couple of days. I probably,
Okay.
I would probably wait about 3 days before you did something real strenuous.
I just got an e-bike too,
Yeah.
so
Yeah.
it's really easy.
Yeah. So if
maybe
you were
I'll
doing,
cruise around on my e-bike.
if you were cruising on your e-bike, you could probably do that tomorrow.
Okay.
Honestly.
Oh, wonderful.
Yeah.
Wonderful.
Like running, cutting, heavy lower body weight lifting, I'd wait probably a week at the least, and then see how you feel. Like if your knee feels about the same as it has, like maybe it's not better yet, but it's not hurting worse, you could slowly start to add those things in. Now, if I'm doing a tendon, or it depends on what area I'm injecting and what the problem is. I might, like, let's say Achilles tendonitis or an Achilles injury, a partial rupture or something. I'm going to protect that longer. I might even put you in an immobilizing boot for like 3 weeks or so. Tennis elbow, I might protect that a little longer just because I feel like if you go back too soon, we're really going to keep it irritated.
Okay. Makes sense.
That doesn't mean no activity at all. It just means not going out and playing, tennis matches for a couple weeks. Yeah.
I think that like this procedure, the earlier you do it, the better. If it's thinning hair or erectile dysfunction for the P shot, the earlier you do it, the more effective it is
Better
for
results,
sure.
yeah.
But you're a maestro with this stuff. I'm really proud of you for what you're
Thank
doing
you.
up here.
Thank you. Yeah.
Any other tips on anything orthopedic wise? Stand up straighter.
Right. Always, keep moving, because moving is better than. I always tell people, even if it hurts, a moving painful joint is better than a stiff painful joint, because if you don't move it, it will get stiff, and then you've got a bigger problem. But not overdoing as well. But as we know, keeping your muscles strong, staying as healthy as you can be with your weight, and making sure all those things that we talk about all the time, blood sugar and blood pressure, and all those things are in check.
Can you see
it goes
this
with
thing?
joints as well.
You see this thing?
I do, yeah. Look at there. You're
I'm checking
doing your
a
Dexcom.
continuous glucometer readings. It's very fascinating. We'll talk about that on another podcast. But insulin resistance, inflammation. You're trying to keep inflammation out of your body for the long term. But I like collagen supplements.
Yeah.
I mean, I think that's our practice is really more baby boomers, people that are aging a little bit, that want to stay healthy and move and not hurt.
Right.
Again, my Dr. Rogers pain formula is going to be out in about a month.
Oh, good.
It's
Yeah.
loaded
We've talked about
and
that, but I haven't
packed.
seen that.
Yeah. There's going to be no other pain medicine like that as far as an herbal preparation for pain. I mean, I've looked at it against like relief factor and some of those, or just glucosamine, chondroitin. I think this is really going to, I loaded it up, so
That's great.
we'll see.
Is it going to be high in curcumin and turmeric? Is it? Okay, yeah. So I do think that helps with
Boswellia,
inflammation.
black pepper, and I've got a couple other secret ingredients that really are going to work really well.
Awesome.
But so I look forward to that, because everybody that comes to us either seems like they're tired or they hurt. Is that right?
Yeah, that's a lot of the complaints. Yeah.
Some of them have brain
sure.
fog,
Yeah.
which goes along with inflammation. But we
It
just
does.
got back from a great conference over in North Carolina where they talked a lot about inflammation and diet. A lot of people I find that hurt all the time, if they cut out sugars, glutens, and dairy, soy, corn, maybe nightshades, they really clean up those inflammatory foods that they're consuming, ultra-processed foods.
Right.
Their joints all of a sudden get better.
They really do. Yeah. I think the decreasing the inflammation, and then a lot of times too, when you're doing that, you're most likely losing some weight, and that helps too to take the pressure off the joint.
That's exactly right.
So yeah, for
It's
sure.
all part of the same thing.
It is. Yeah, it all goes together.
Yeah. Well, I appreciate you doing this
Yeah.
today and coming in.
Yeah.
She's going to inject my knee.
All right, very good. So we've already drawn his blood, as he said, and we've already centrifuged it. So we got about 4 or so cc's of PRP that we're going to inject in his knee. And you can really, for the knee, you can obviously approach the knee in different ways depending on your goal of what you're treating. But then you have a little more joint space on the lateral aspect of the knee, so you're not worrying about the fat pad on the medial side. So a lot of times when people get joint injections for arthritis or meniscal injury or whatever it may be, a lot of people will go on the lateral aspect. You can't even come super patella. I hardly ever go up here unless I'm aspirating a knee, and you've got a big suprapatellar bursa that's swollen. I'm
right.
going to aspirate up here, and then I would probably inject through that same area because you've already accessed the knee joint. But most of the time I do it in this seated position, just like you're doing here. And you're not allergic to anything, right?
No.
And I always use my pen just to mark my spot. That way I know I don't have to touch it again once, and I don't put an ink pen on there. Just put a little circle with the end of the pen. That way I don't have to touch it again, but I know where I'm going. We're going to clean
And
you
you
with
use
a
that
little-
freezing stuff too, don't you?
I do. I use the ethyl chloride, yeah.
Maybe that's why I didn't feel it last
Yeah.
time.
It just numbs this. I mean, you still get that pressure sensation, I
Sure,
guess.
sure.
But it does help to numb the skin a little from the needle stick itself. So, and of course, if we were doing a steroid injection, I'd be going in the same way if we were targeting the joint, And if I were doing, I don't use lidocaine to numb up a knee joint injection if that's what we're doing, just because really you're getting a shot for a numbing.
You don't
and
need
then
it.
Right, it's one-time shot. So might
When
as
would
well
you
just-
use lidocaine?
If I were doing something that I know was like, if I'm doing a hip injection and I'm using
Mm-hmm.
ultrasound, a lot of times I'll use lidocaine for that, just because it's a obviously it's a much deeper injection, and I'll numb it up a little bit first. If I'm doing a tendon like an Achilles tendon or distal bicep tendon, which I've actually only done one of those, distal bicep tendon, I did numb that up beforehand. Just because you're doing maybe multiple injections along the
Yeah.
tendon itself, and it can create
makes
some more
sense.
pain. Yeah.
That makes sense.
Okay, now just relax that knee for me. Here comes the cold spray. It startled you, didn't it?
You hit my reflex.
It's really cold. It does burn a little bit. That's that kind of white that you're seeing on there, just where the skin
think
is
it
getting
burned at
really
all.
cold. Okay, and here we go. That's it. Now,
Wow.
when we're in there, it's gonna.
That is awesome.
And like I said, it's, we're seeing a little bit of a blood tinge fluid for him. That's super common, but a lot of times it does look like that liquid gold, as you mentioned. That's
Well,
it.
that was nothing.
Yeah.
You're an amazing injector. That's just so impressive to me.
Definitely lots of practice.
The only thing that kind of startled me at all was the freezing stuff.
Yeah.
I didn't feel the needle at all. And that's a pretty long needle too with the knees.
It is, yeah. I use 1.5 inches. So.
That's just
All
an
right.
amazing procedure. Didn't hurt at all. I'm really looking forward to the results. I know it's going to work. I may do this once every 2 years. We'll keep a record of,
Sure.
pain and all that.
Yeah.
Like I tell people, I wouldn't do anything on a patient that I wouldn't be willing to do on myself. You're the same way.
Right. Yeah.
But anyway, so PRP, platelet-rich plasma, the centrifuge makes a big difference.
Yes.
Like we used to tell people, we used to put them on crutches after this and say, don't bear any weight on it. I think that's kind of passe.
Yeah,
and
I don't really think that you have to be that extreme with your activity restriction. Again, depending on where we're injecting. But most of the time, no. Most of the time, it's just like take it easy for 3 to 5 days. Be smart with your activity. If it is hurting worse, which is possible, then you'd probably want to protect it for longer.
Yeah,
but you
yeah.
wouldn't, I wouldn't want to tell you to go out and run a marathon next week or anything. But getting back to, if you're a person that's normally exercising and doing activity, you can certainly get back to most of those things within a week or
And to
less.
say it did get a little stiff or sore, you wouldn't advise using ice on that, would you?
For the next 48 hours, I would not.
Okay.
I mean, if it were for some reason really achy tonight and you needed some ice for 5 or 10 minutes on there, I think that'd be okay. But I wouldn't want you to do like a 20 minutes on, 20 minutes off
yeah,
kind of thing.
okay.
Because we want the inflammation actually
Yeah,
to occur.
right.
So we want to try and avoid excessive heat on it, excessive ice on it. The anti-inflammatories by mouth that we talked about,
Yeah, okay.
or topical anti-inflammatories for 3 to 5 days after at least 3 days.
At least 3 days.
At least 3
on
days
no
after.
Advil. Okay.
Right, no Advil. I usually tell people no curcumin either. Maybe
Oh, good.
even,
Good point. How
hold off
about
on
like
their-
fish oil?
I usually have them hold off on the fish oil.
Okay, or
Yeah.
aspirin. I didn't take my aspirin or any non-steroidals, which I rarely take
Okay.
anyway, yesterday.
Good.
So my aspirin, should I resume it in a couple
It's a
couple
baby
days?
aspirin.
Yeah, I just
Yeah,
take an 81
I'd
every
say
day.
in 3 days. Go.
Okay,
You can get
okay.
in 3 days. You can probably add all that back, but I would hold off on it for the next 3 days. And then sometimes too, we didn't talk about this earlier, but sometimes we'll repeat the PRP. Let's say, I mean, you know, before months or years goes by, let's say if we're treating, if you came back to me in 6 weeks and said, gosh, my knee is 80% better, when you still have this like little 20% that's kind of hanging on, but you've had a really great response, I would inject it again either at that point in time or maybe at the 12-week mark. So
Okay.
6 to 12 weeks after today, maybe putting another injection in there. So you could do it as early, you know, repeat it as early as that if you needed to, wanted to.
Last time one was it. That's all it
and
took.
that may be all you need. So
I agree with you though. The body has an amazing way to heal itself.
right.
I mean, we've got the factors, and this just speeds it up, and you're using your own blood. I mean, it's
Right.
just amazing. It's painless. It's a good way to go, and not many people even know that that's available.
Right.
They just keep taking Advil all the time,
Yeah.
you know, and they're not really healing it. They're just decreasing inflammation, which increases your risk of heart disease, and it's not healing for sure. So I think this is a great procedure. Jill, you're amazing.
Well,
Thank
thank you,
you.
thank
That
you.
was painless and just pleasant. And
Good.
come see Jill in Bristol.
Come see us.
She is the bomb.
Yeah. Well,
Thanks,
take care
guys.
of all your joint issues.
Take care of all your joints. If you need
Yeah.
Jill, go to her. If you need a physical therapist, look for Ernie.
Yes,
I mean,
for
amazing,
sure. Yeah,
amazing.
he does great work.
But anyway, good to see you guys this week. We'll see you next week.
Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.